So, in this lesson, we'll be discussing the treatment and prognosis of dogs with myxomatous mitral valve disease. If you didn't watch the previous video, I advise you to take a look to understand a bit about the clinical signs and diagnosis of this disease before continuing this video. What's happening in the heart, as we previously discussed, allows to maintain the function of the heart for a significant time period, but this is not sustained forever. Dogs with this disease can compensate for a very, very long time, but in a matter of years, as the disease progresses, dogs start to decompensate. It is important to stage the disease for treatment decisions and establish prognosis, and that is why in 2009 it was published the ACVIM consensus statement that stages dogs into 4 groups, stage A to D, and helps guide clinicians in their medical decisions. I bring you today an update of the original document issued in 2019. So, in stage A, we have a dog with high risk of developing heart disease, but currently has no structural disorder of the heart. This dog might be, for example, a Cavalier King Charles Spaniel or other predisposed breed. In stage B, we have dogs with structural heart disease with a heart murmur, but that have never developed clinical signs caused by heart failure. This stage is divided in 2 substages, B1 and B2. In stage B1, we have asymptomatic dogs with a heart murmur that have no radiographic or echocardiographic evidence of cardiac remodeling in response to this mitral valve disease. In stage B2, we have asymptomatic dogs with a heart murmur that have more advanced mitral valve regurgitation that is severe and long enough to have caused radiographic and echocardiographic findings of left atrial and ventricular enlargement. In stage C, we have dogs with current or previous clinical signs of heart failure, as we discussed in the previous lesson. In stage D, we have dogs with end-stage mitral valve disease in which clinical signs of heart failure are refractory to standard treatment and usually require acute hospital-based treatment, while those on stage C can be managed as outpatients. So let's see the treatment options for each stage at a time. So in stage A, we have only a predisposed dog, so it is not recommended any drug or dietary treatment. In stage B1, no drug or dietary treatment is recommended because at this early stage of disease, progression to heart failure is uncertain and there is no evidence that medication is effective at this stage, but it is recommended a re-evaluation by echocardiography in 6 to 12 months. Stage B2, so dogs at this stage have a high intensity murmur, echographic signs of cardiac remodeling, left atrial and ventricular enlargement, and signs of heart enlargement when performing a chest x-ray. So these dogs are recommended to start pimobendan that improves heart muscle strength and lowers the pressure in the arteries and veins, and change also to a diet with low sodium but high protein and calories to maintain a good body condition. We can also add angiotensin converting enzyme inhibitors as enalapril and benazepril to lower the blood pressure and afterload or the resistance to blood flowing out the heart. If the patient has cough resulting from cardiac enlargement, we can also give cough suppressants. Some cardiologists recommend occasionally surgery in advanced stage B2 disease to repair the mitral valve, but depends of the patient and of course the finances of the owner. Stage C, so these are dogs that have clinical signs of heart failure as intolerance to exercise or cough. In an acute onset of heart failure at the hospital, we have to take measures to reduce acute clinical signs as respiratory distress, cough, pleural effusion, ascites, etc. Then it is recommended as chronic home-based treatment furosemide or torsemide, continued treatment with enalapril or benazepril, and pimobendan, and introduce spironolactone, that is an aldosterone antagonist. When it is thought to have low complication rates, stage C patients benefit from surgery to repair the mitral valve. In cases complicated by atrial fibrillation, diltiazem, often combined with digoxin, is recommended. Cough suppressants and bronchodilators may also be used where there is cough and respiratory distress. Dietary changes are also recommended to prevent the cardiac cachexia, a loss that is a loss of muscle associated with heart failure. These dogs should eat a low sodium prescription diet and maintain an adequate calorie intake to minimize weight loss that often occurs in heart failure. Also consider supplementing with omega-3 fatty acids the diet of these dogs with decreased appetite or muscle loss. Stage D. So these are dogs that are refractory to standard treatment and those in which we tried all the drugs I talked before in stage C and still are in really bad shape. Dogs that are no longer responsive to furosemide can be treated with torsemide, that is a potent diuretic. Um, we may need to perform an abdominal paracentesis or thoracocentesis to treat ascites or pleural effusion, respectively. In addition to an ACE and pimobendan, we can reduce even more the afterload to reduce the effort of pumping the blood out the heart, only in patients that can tolerate with hydralazine or amlodipine orally, or even with concentrated infusion of sodium nitroprusside or dobutamine. In cases where pulmonary hypertension is present, sildenafil and bronchodilators are recommended. At home, these dogs should continue furosemide or torsemide treatment, spironolactone, also pimobendan, amlodipine or hydralazine, digoxin, sildenafil, cough suppressants, and bronchodilators, usually with higher dosage compared to those administered in stage C. So there are many factors to consider when answering how long can a dog survive with myxomatous mitral valve disease, but most importantly is whether there are signs of heart failure and the stage of disease they're in. Dogs with structural changes as cardiomegaly should do regular checkups every 3 to 12 months, as long as these dogs have moderate exercise restriction and diet with low salt and respond greatly to medication. They should have a good quality of life for many months or even a few years. According to a study from 2021, dogs in the stage B1 had longer lives when compared to dogs in stage B2, C, and D. And dogs had higher risk of dying if they had clinical signs as dyspnea, syncope, pulmonary crackling, or radiographic, echocardiographic, and electrocardiographic evidence of heart or left atrium enlargement. Some complications that could rise and have an impact on prognosis are bronchial compression, pulmonary hypertension, arrhythmia that leads to syncope, pulmonary congestion and edema, and atrial rupture with development of hemopericardium, which means that there's blood in the pericardium. But to resume, dogs that are stable with their medication and have regular checkups at the vet with echocardiography and chest x-rays are good candidates to live for a few years more. So if you have any questions, please leave a comment below, and if you like this video, like and subscribe. Thank you.